Saskatoon, Saskatchewan, a picturesque city on the Canadian prairies. But the city's first responders are some of the busiest in the country. The men and women of Saskatoon's MD ambulance respond to 30,000 emergency calls per year. These are the stories of the paramedics who race through the streets to answer the call.
What do you think the night's gonna bring us tonight?
I don't know, we're gonna see. We're gonna see how the night goes.
You never know what you're gonna get.
And there's a guy trying to get killed. Whoa, we almost had a patient.
That would have sucked.
He almost got hit by a car on his bicycle.
Base 267, you're responding Bravo for an unknown aged male. He has a laceration to his forehead. Unknown what happened.
We are heading to a residence, sounds like involved in some sort of domestic dispute, and city police are on scene requesting us lights and sirens.
When we walk into the house, we really need to be aware of the possible dangers. There could be multiple people, there could be weapons. We need to be aware of our surroundings.
Why don't we grab a seat here? Can you take off your hat for me? I just want to get a good look at you. Tell me what happened. I'm just gonna check you out, okay?
I'm not too sure actually. I either got clubbed or kneed to
Clubbed
the
or
head.
knee? Okay.
Yeah.
Did you lose consciousness at any point?
No, I didn't.
No?
I just
No bumps on your head or neck?
No, just a nice little gash.
How many times was he hit?
Once.
Was he knocked unconscious?
Yeah,
Not at all.
Have you guys been drinking?
He has. I just came home from a soccer game.
And how do you know him?
That's my brother.
Do you know who got you?
Yeah, just a brotherly argument.
We'll get you out to our truck here and get you dressed up, okay? Get you clean. Now,
You got shoes?
Yeah, I just got my shoes right on the side here.
These brothers definitely had a disagreement. Sounds like they had already solved their issues by the time we got there. We just needed to kind of tidy up after.
Let's have a.
ah, dude. So do you know what he hit you with?
He was like rushing me, and I had like a golf club.
I'm gonna clean you up here while you're talking, okay?
And then he was like push Zach, and he's just like bleeding on the ground.
Got hit pretty, rocked pretty good.
And he's just like freaking out, like really bad.
It turns out that one of the brothers actually filmed the whole entire fight on his cell phone.
Dude, you were coming at me, so I grabbed the golf club. I grabbed the golf club because you were coming at me. And until I was backing up.
I was like freaking out on him too really bad because I was in the moment. I was like just getting tossed around.
And I told you with the fucking golf club. And then you punched me, dude. You punched me after I told you.
And then I was like bitching at him, and I like, threw his hat at him, and every time I threw his hat at him, he like turned around and like rushed me at like right in my face. Like listen, because he's on top of me. Look.
Look at this guy! I threw your hat at you, man! He came after me, so you might go. Tyson, you're going to jail, man.
I was like, look how much I'm bleeding, man.
Shit back at me. I threw a hat at you, guy. You probably broke my nose again, guy.
That's so ridiculous. Holy crap, man.
Okay.
Pretty silly, eh? I put on
Well.
my jeans backwards.
You got dressed in a rush when you found out people were coming. It's honest mistake. Okay?
All family has issues. I have brothers. We all fight a little bit. Sometimes you hug it out, sometimes you duke it out. At the end of the day, you're still family.
Base to 36, you're responding Delta for a 57-year-old male. He's having some chest pain, difficulty breathing. He does have a COPD history.
A cardiac with a little bit of respiratory, or respiratory with a little bit of cardiac?
Yeah, no kidding. Anytime we get called for a patient with chest pain or shortness of breath, we want to get there in a hurry.
He's short of breath, he's got chest pain. I'm thinking he's gonna be sick. You know, time is of the essence.
Hey, this is Darren. He's 57. He's got 8 out of 10 chest pain.
It's okay.
Easy at 8 liters a minute.
The firefighters have put the patient on oxygen until we could get there to give him medication. Point to me where your chest pain is on your chest. On the left side there. You're short of breath as well? Okay. I'm gonna take a listen to your lungs again and just see. Take some breaths for me while I listen.
He's 88.
In a normal patient, we want to see oxygen saturations of 95 to 100%. This patient was 88% on oxygen. He's not moving a lot of air. He's silent in the bases. I don't hear a lot of movement, and then he's got an expiratory wheeze on the upper, I heard. We're gonna give you a nebulizer, okay? We're just getting it set up. We need to give this patient a nebulizer of Ventolin and Atrovent to open up his airway. Do you have any other medical conditions other than the COPD?
Lost a lot of weight in the last. How come? I don't know.
Have you been throwing up?
Yeah.
Yeah?
I need more
Okay, it's coming. It's going into you right now.
Focus on your breathing for it.
I couldn't imagine feeling the way this patient feels. You're starving for oxygen, but you can't get any.
What we're gonna do is we're gonna stand you up and we're gonna put a seat underneath your bum.
You know, this guy actually can't catch his breath. So the anxiety comes with it because he's like, you're panicking.
Maybe more of a COPD exacerbation than a chest pain, but...
Picture if you were drowning. You know, like the first thing you do is like, you panic and you try to get to the surface, and then you end up using more oxygen.
I can't breathe though.
There's a sense of fear within him. It's compounding our situation.
I don't want that one. We have another mask coming here for you.
Listen to me, okay? We're gonna try this mask. He's not responding to the nebulizer, so we need to try something else. It's a big mask that goes on your face.
CPAP provides continuous positive pressure within the airways, which helps keep the lungs open and alleviates shortness of breath.
We're gonna put this mask on your face, and it's got a very high level of oxygen, and it pushes it in your lungs, okay? Big breaths.
Yeah.
Patients are usually quite fearful of the CPAP mask. You're already short of breath, plus the feeling of claustrophobia. You don't want that big mask on your face. Does it feel better? Yeah?
I guess you can't breathe. That's a reason to be anxious.
We're definitely seeing an improvement in our patient. Our treatment is helping him. His anxiety is decreasing.
So let's see. We got
How is your chest pain now? That you've relaxed a little. So our stats are 99. His work of breathing is decreasing and becoming much easier. That mask is really helping, hey? Yeah, good. I'm glad we tried it.
When you see this patient take a sigh of relief, you can take a sigh of relief. You know, you finally found a treatment plan that has helped this patient.
For me, good calls are the ones that you just have automatic reactions to. You don't really have to think, you just react.
When somebody is having a true emergency, when I can do something to really help them.
Something that gets your adrenaline going, that makes you think.
Where you know what it is, and you know how to treat it, and you know what you have to do.
Part of the reason I'm here is for the adrenaline rush of it. Some people like jumping out of an airplane. I like to see somebody really sick and then try and fix that.
You're looking for a female patient, white top, black pants, and no unconscious and breathing status at this time.
Right here, right?
Yeah, so we want the alley behind.
This guy, he's on another level too.
At this point, details are vague, and we don't know exactly where this patient is.
Are you guys looking for the girl?
Yeah, is she over here?
Yeah.
Hi. When we find this patient, she's between two parked vehicles, which seems like a very dangerous place. Hello? The way the patient was situated, if a truck would have reversed, it probably wouldn't have seen her. We're gonna sit you up. What's your name? She definitely had the potential to get run over or injured from that vehicle. What's your name? It's okay. We're gonna help you, or the ambulance. Just watch your head, you're gonna hit that mirror.
At this point, we don't know if this patient's passed out We don't know if this patient's been left here.
Do you want to take a walk to the truck here?
Regardless of why she's there, it's definitely not a safe place for her to be sleeping.
Are you hurt? No. You just drank too much? It's quite clear that this patient is intoxicated, but we still need to assess her and make sure that there's nothing medically wrong with her otherwise. All right. And did you throw up?
Not since I went for a run. Last time I went for a run was, actually December.
We don't want to see this girl end up in the drunk tank or the hospital, so now we need to find her a safe way home. Hopefully we can find her friends to come give her a ride home. Hi, this is Callie with MD Ambulance calling.
You know, we've all been young. We've all probably made decisions that we have regretted.
Would you be able to come get her? Luckily for her, this was a happy ending. She didn't end up getting assaulted or run over by a car. A lot of bad things could have happened.
We've been searching for about half an hour.
You guys got her?
We got her, yeah, we got her.
Fortunately, things turned out well.
I remember when I was 19.
East to 67. You're responding Delta for a 55-year-old male having chest pain, not breathing normally.
.55 male with chest pain.
First thing we need to figure out is this cardiac related or is this more of a muscular issue that he's having?
I haven't tried the door yet. You got those gloves? Call an ambulance? Hello? Can we turn on some lights? Can we turn on some lights?
I don't need an ambulance.
Let's just find these lights. Okay, sir, what's happening today?
I had a bad accident there a couple of days ago.
Can I check your heart rate there? I just want to feel your wrist. Okay, you said you were in an accident?
I did a little while ago there. Like I hurt myself real bad here.
Okay.
I don't know, I can't breathe there.
How long is a little while ago?
So as we meet the patient, I start to kind of take a look around the apartment.
You got bugs crawling in your apartment all over the place, eh? We could see bugs on the wall, on the ceiling, on the floor.
Bugs everywhere.
There's movement on the floor around the garbage can, and there's movement that's going across the ceiling. BB's in here, let's go.
I'm an IV user.
You're an IV drug user?
Okay. What are you injecting here?
Dilaudide's a form of an opiate, kind of like morphine. It's very good for pain control, but it's also highly addictive.
Don't touch any of that.
Let's get you outside. Yeah, grab your keys.
This gentleman's addiction has clearly taken a hold of his life. He started to neglect everything else.
So he's saying that he fell off his bike a couple days ago, just a pedal bike, and he's got some pain to his ribs.
Sorry, that hurts, that little bit of pressure?
How did you get started on your Dilaudid, Richard?
That goes back to 1982.
What happened in '82?
I fell off a roof. I used to be a roofer.
Turns out that about 20 years ago, this guy had a serious work accident and has since become addicted to opiates.
I used to just pop it. Yeah. But then I found out it's faster to
inject.
Yeah.
He needs some help. With luck, he'll be able to get that treatment and get his life back together.
Have you talked to your doctor about the methadone program?
I don't want the meth. I'd rather get sick. How long are you going to be sick for? 3 days?
How long have you been using for?
20 years.
Yeah, 3 days isn't going to cut it. He seemed pretty sincere that he wanted to quit his addiction once and for all.
I'm going to beat this.
I think you will.
I'm going to.
Sounds like you're ready to be done.
I am. I want to stop.
East to 67. City police are on scene with 2 patients involved in a domestic assault. Unknown injuries.
Did they say a domestic?
Said possible domestic, 2 patients. Obviously a family fight.
On the way to the scene, we've got two concerns. What kind of injuries are we dealing with? And where is the perpetrator?
Hey. What's going on?
They were both assaulted.
You both got hit?
It's
okay.
And I seen like lights or
Everywhere.
Hit me everywhere. Hit me in the face and in the arms.
With these kind of calls, the patients are oftentimes very emotional.
You can stay right here. We can stay right here.
I don't even know like.
No, it's okay. It's okay. Anything broken?
I doubt it.
Can you stand up?
You got hit a few times?
Yeah.
In the head?
Yeah.
Does it hurt anywhere I'm touching? I'm trying to hold still.
These women are both really shaken up. They've been in a very emotionally charged situation. They've been assaulted. We need to be able to calm them down so that we can help them.
We're sitting here and drinking like whatever, right? And then she started acting up, and I'm like, why?
We started beating her when she came to ask the neighbors for some help.
Nobody deserves this. Nobody deserves this stuff like this and like that, man. For real. I don't deserve it.
So this is not part of the this is just
Looks like no one's gonna want to come. They are banged up a little bit, but nothing too serious.
You're gonna file a report with the police, right? And hopefully they'll catch them and...
I hope so. She shouldn't be treated like that, man. I couldn't even help her. I didn't even know how to help her.
The perpetrator of this crime needs to know that his acts are not gonna go unpunished. If there are no consequences, then acts like this are just gonna keep happening.
How are you doing? All right,
Do you guys have him?
The police have him, yeah. I think they caught him. I hope everything works out for you. It's kind of a tough way to spend the night.
Our role with this kind of call is to let our patient know that we're here for them.
If you change your mind about coming to the hospital, just let us know. We're going to be here for a bit yet.
We need to support them, and we need to make sure that they know that they have the resources and the help that they will need.
Can you kind of give me the backstory before you go?
The unfortunate part with it is a lot of times that the victims never get away from it. They're often drawn right back into the same scenario. Hopefully the two women involved in this incident can get the help they need, and this doesn't happen again.
You were coming at me, so I grabbed the golf club.
At the beginning of the night, the call we went to where the two brothers fought.
So do you know what he hit you with?
We transported the one brother to the hospital.
I got hit rocked pretty good.
He received 6 stitches in his forehead. He had a CT scan, and he was released from the hospital.
Most brothers over time figure out how to settle their differences without fighting. The brothers say that they deeply regret what happened that night, and they have since reconciled.
You're gonna put this mask on your face, and it's got a very high level of oxygen.
For the COPD patient we responded to earlier in the night,
Big breaths, big breaths.
he was transported to hospital and treated for over a month.
Our patient earlier tonight with the chest pain,
I know everything is showing that you're having some kind of muscular pain.
he went to the hospital and was given a chest x-ray and a further cardiac workup. The patient is doing better now. He says he wanted his story told so that others know calling for help is the right thing to do.
Hit me everywhere. Hit me in the face and in the arms.
Both of these women are being very brave tonight and have decided to press charges against the assailant.
Nobody deserves this.
It's very important for a victim of a domestic assault to make her official report to the police. If a report is never given to the police, the abuse will continue to escalate. The only way to deal with it is to stop being quiet.